So thank you very much for that, Tracy, and I will call to be the next witness, Fiona Robertson, if that's okay. Fiona.
Hi, everyone. Thanks so much for inviting me to this. I'm here to speak about long COVID. Just over a year ago, I went out for my birthday night out with friends, and we already knew it was the last time we'd see each other for some time, but people were still talking about this as just a bit of a weird blip. Well, most people were. By this point, disabled people were already trying to raise an alarm. A few days after that night, I wrote a blog post and a series of threads begging people to listen to disabled people because the UK government had begun talking about a herd immunity strategy. We were still talking about the virus as if its course is get it and either die or recover. That is not true. The other course is not die, but not recover either, or recover but not to previous health. The disability community is full of people who got there because of the aftermath of viruses. Previously healthy people who, long after the virus was gone, were living with pain, exhaustion, and cognitive dysfunction. When I was 19, I woke up one day and I couldn't walk properly. Over the next few months, my ability to function disappeared day by day until I was almost bedbound. As a young woman with pain and exhaustion, I was told, of course, initially that it was attention seeking or psychosomatic or lying. Eventually, they decided it was either the result of a head injury or post viral fatigue syndrome caused by a severe bout of flu. I had recovered, but it had taken a toll. Many years later, I would discover that it wasn't just ME, but the post viral effects activating an acute form of an underlying undiagnosed genetic condition. Viruses can have catastrophic ongoing effects on a person's health long after they've technically recovered from them. I lost everything. The career in theoretical physics I'd worked my life towards was taken. I've never been able to get back to it because the cognitive disruption makes complex maths out of reach. Even though I can walk again now, I need a stick, and I live with chronic pain, immune and gastro issues 20 years later. It's not like we didn't have warning that long COVID would exist, even if it was just disabled people warning about it at the time. The SARS outbreak, another coronavirus, left lasting effects on a large percentage of the people who'd recovered from it. After 2 years, many were still experiencing ongoing fatigue, many needed medication to stay employed, and many had not made it back to work at all. A year ago, I wrote, "This is one of the major reasons Boris's herd immunity idea was so catastrophically dangerous. Just letting everyone get it will lead to a massive uptick in people experiencing post-viral symptoms, many of whom will go on to become permanently disabled. There are also going to be people becoming disabled because they have conditions which are going unmanaged in the chaos. There are secondary risks to the virus. Those people will all then be entering a system designed to cause trauma and hardship at the exact same time. The DWP already cannot process what it needs to process because the system has been designed to be cruel and labyrinthine, and most resources are poured into tribunals. We begged the DWP to suspend protocols requiring the assumption of fraud, to pour resources into making sure newly disabled people were able to take the rest they would need to avoid worsening post-viral fatigue syndromes and turning them into chronic conditions. We wanted waiting times to be slashed, the presumption against the applicant abolished, interim measures to provide for applicants to be available from the moment of application while waiting for it to be processed. And we were ignored. There was a failure to understand this reality and plan for it at the beginning, instead of when a whole lot of people discovered for themselves what grave and systematic violations of the human rights of disabled people actually means. As the first few articles about long COVID began to show up, people were calling it mysterious. Our focus shifted somewhat. A few people suggested, and I genuinely think this is a good idea, that every long COVID patient should be assigned a mentor with ME to teach them how to navigate systems, how to advocate for themselves with doctors, how to recognize and recover their own sense of self in a world where we're programmed to believe a disabled life is worthless. But that last part, unfortunately, turned out to be true. Other things we warned about at the beginning, because our experiences with the medical profession are not the same as able people's, with a prioritizing of able people's lives, even when there was no difference in likelihood to survive. The assumption that a disabled person's life was of lower quality, ignoring us raising concerns about our conditions. We now know that a disabled man in England and Wales is more than 6 times as likely to die of COVID, disabled women 10 times as likely. We also know from long experience that women are not believed when we report symptoms and conditions. These things are not likely to be unrelated. Nearly 2/3 of the people who've died from COVID are disabled, and everywhere for a year, we've seen what was previously hidden under veils of politeness and euphemisms. We are expendable if it saves the economy, if it means able people aren't inconvenienced. Even now, the rush to reopen everything while sentencing disabled people to never leaving their homes again is being pushed by people with power, while we keep yelling from the sidelines. Everything in the next term of government will be affected by this catastrophic failure to contain the virus. We didn't have enough accessible housing to begin with. We didn't have an accessible infrastructure to begin with. And as a whole lot of people, particularly women, people of colour and already disabled people, are discovering, the medical system does not deal well with post-viral chronic conditions like this. They are still recommending treatments known to worsen conditions, still referring to it as controversial. And even the ones who recognise the severity of it are saying things like, this isn't a post-viral syndrome, this is real. In terms of what we do next, disabled people must be at the heart of it. Imagine how different this all could have unfolded if disabled people had been listened to over the years. Remote learning and working, which we'd been told was impossible for years, would have already been in place and ready to scale up, with the associated safeguards like employers paying for increased bills at homes, possible harms and isolation already addressed and understood with solutions in place, and crucially, a medical and social security system ready to deal with the challenges of chronic illness and decisions on how support needed to be given. There are opportunities coming out of this, but they have to be taken seriously. We can make sure flexibility is built into work and education, different approaches to social lives and interactions, more awareness of the effects of isolation, which disabled people have been living with all along, and community solutions to that prioritized. A transformation in how medical professionals see people who have long-term conditions which are not easily managed and not easily cured. The respect and recognition of mutual aid groups is one of the most positive effects I've seen come out of this, but they need to continue and be organised properly, and all of that requires putting disability justice at the heart of programmes. There is nothing this won't affect. Work, business, housing, the economy, health and social care, community endeavours, so many of which ran on volunteers who were in vulnerable groups who have now died. We are also aware of how quickly we'll be forgotten again if everything goes back to normal. How quickly it's assumed it's okay with us that we'll just shield forever to avoid the magnified risk we face, even when the measures put in place to mitigate lockdowns are stripped away. We already struggled getting out into our communities and lives. Please don't sentence us to an even more isolated and even more high-risk life, when if we'd only been listened to in the first place, we might have been able to avoid so many of the most terrible effects of this pandemic. My questions to you are, what will you do to ensure people with long COVID have joined up health and social care and are taken seriously over the long term, even when the initial crisis is over? How will you ensure disabled people are included in the planning of all of the elements of government this will affect? And how will you work to make sure the lessons learned from long COVID are extended to other people with similar chronic illnesses who've been ignored and dismissed for so many years? Thank you.
Social carnage, violence against some of the weakest people without voices in our communities that are so often overlooked. And it's something I kind of encountered previously when I was an MP. I remember speaking with a lady who suffered from ME and just how she struggled to even get recognition. You know, she's been gaslighted constantly by the system because people were saying she's not sick, you know, she's just faking it. It's psychosomatic. You know, it's an excuse to just be a skiver, basically. That was kind of what she was, and she was, you know, I remember we had a debate in Parliament about, you know, trying to recognise ME and the sort of clinical reasons for why she is experiencing the pain she is experiencing. even just getting recognition for that before was difficult enough. And I think long COVID, we might well see the same thing. My friends, one of my closest friends' partners works for the Scottish Government in a large office building in Glasgow, civil servant. He was fit and healthy, he's in his early 30s, and he caught COVID on his way to work or while he was at work, despite best efforts to maintain hygiene, to maintain social distancing. He suffered from COVID, but has been basically suffering from post-COVID syndrome, long COVID. And he's been on long-term sick for nearly a year now. And in fact, just this week he's now been considered to have a long-term disability under the Equality Act. So, that just shows you someone who is my age, can be plunged from being a healthy kind of active person into a state of chronic sickness. And I think is the country doing enough to recognise the long-term implications? That's why the kind of initial idea of what was it, herd immunity was so obnoxious. Almost was some sort of psychopathic, really, and its kind of disregard for vulnerable people. But also it spoke to a government's mentality which is focused on capital rather than the welfare of the citizen. And I think that's been such a common theme through so many areas we've been discussing so far, that we need to shift massively. And I think some of the measures we need to look at is recognising long-term chronic conditions as part of both care, but also ensuring minimum income is there for people to be supported, and they're not feeling pressured to return to work, which makes them even sicker. That they're not being ostracised or excluded from the community. And I think some of the points you raised about accessibility, about learning some of the maybe some of the more positive aspects of how we've managed some of the solidarity around of the lockdown, it would be beneficial. But learning the right lessons. But crucially, our social security system is completely inadequate to deal with these long-term chronic conditions. And I would like to see that recognition changed, because I think we're going to have a lot more people of all ages coming out of this, this pandemic, which is not just about, I got COVID and I got better. There's a huge hinterland of people who are going to be chronically sick. And like you say, the displacement effect on the National Health Service will have caused further, morbidity, if you like, in society with other conditions. So I think, the idea of a national care service that will be established on the same footing as the National Health Service, free at the point of use, a nationalised system, remove the pernicious effect of private profit from the system is critical, and I would like to see that developed as we go forward in the next Parliament, with the idea that those who have experienced the trauma of this pandemic are at its heart, and we understand from them their experiences rather than just assuming things. Because I think your testimony is a good example of how we can go about developing policy that's effective and responsive. Thanks a lot.
Thank you, Paul. We will take Pam next. Pam, please.
Thank you, Carmen. Like I said, Fiona, it had brought tears to my eyes when you were speaking, especially when nobody's listening. Everybody's so busy running around, and obviously, COVID's happening to everybody, and they don't realise that what you're going through as an individual, and then basically what you've gone through after. So I did mention that to you, that I went through it. Now, we're very frightened that the BAME community, that we can catch it very easily. My mother has been not out the house basically for a whole year. A woman that did nothing but all her life voluntary work from morning to night for a whole year is in her house because we're so scared that she can't go out. And if she goes out, and she's her second vaccine, and she is quite happy. She's like, okay, that means I can go out. And we're like, Mum, no, you still have to be very, very careful. So I totally understand how you have to shield, protect, whether it's vulnerable, disabled. So I'm with you on that. But I'm going to talk a little bit about when you talked about, long-term COVID. I had COVID, and I've got certain things I can't drink, I can't eat, otherwise I start wheezing. And then somebody that used to run a marathon can barely run 5 minutes now. My sister, she got it really badly, that her after effects. Now, she went to the doctors here in Scotland a few times. They've took her to the hospital, but they can't really do anything about it. Now, the NHS, this is the NHS in Scotland that is a devolved power, and they're very under-resourced. So this is the SNP, Scottish Government, devolved power. For those of you, we've been hearing today the Westminster government's for everything to blame. So it's important to say what devolved powers are as well. So on that, and she's went and I don't turn around and blame the NHS. The NHS have done an amazing job, but people like us will be left out here, because when will it come that we need to look at the lessons learned, that the fact that what are our effects and what's going to happen to us? I mean, I don't know what like you said, certain effects that could lead to certain things. We've got no idea that is this part just time being or later on. I mean, 6 months it took me to get my senses back. I mean, that's a long time, and and my sister. So what I would say on that is there's a few things. Our NHS and our volunteers have done a most amazing job, but the thing is, they can't do it without funding and resources. And something that the Scottish Conservatives are promising is that we would give £2 billion to the NHS to invest in it so that we can tackle these kind of things, but also £325 million so that we can tackle a large area. Now, mental health is going to be with children, adults and elderly people as well. So we need to make sure we tackle that, but also backlog. Now, this is a brand new, basically, war we're fighting with COVID, but there's a backlog of issues already going on. And with people that happening and then COVID happening, there's so much more the NHS needs. So that's why we're promising another £600 million towards that. And I'm going to leave you a couple of thoughts here. In Glasgow, our candidate that's standing is Dr. Sandesh. And, do go onto social media. Dr. Sandesh is dealing day to day with issues in the NHS, what we're talking about today, right? Dr. Sandesh has openly said he got outdated PPE equipment in Scotland, which was a devolved power, so the Scottish Government brought that in. So basically, straight away, it was out of date, they were handing out. There was things like, we mentioned, you've probably heard Jean Freeman talk about the care homes. Tonight, we keep talking about Westminster's to blame. I'm not saying that there's nothing to learn from here, there's a lot. But what about the care home scandal here in Scotland? Sending those people out of the hospital into care homes. How many people died there? How many loved ones lost their grandparents, sisters, brothers, because of Jean Freeman just saying, sorry, all these deaths, these people died and it's just a number for her? No, I'm sorry, the SNP, the Scottish Government, have to actually own up to basically things that they could have looked after here and did better as well. And I think what you've just spoke about, everything, the NHS cannot do it without the appropriate resources and without the proper funding. And that's something that the Scottish Conservatives promise, that we will make sure we move forward. But I'm also going to say that there's something that I am going to take forward as, Fiona, that the after effects, that's something that I know now there's a big gap here. Right, and I'm sure it's in the United Kingdom as well, if you want to call it England and the rest of the places. But in Scotland, that's where I am today, and that's where I have got my side effects here, and so is my sister. And that's something we are hoping that we will push. When I'm elected on the 6th of May, I will not only make sure that vulnerable people, that whether it's disabled or whether it's elderly people, are kept safe, but also to make sure that we bring together all the stories or all the lessons learned to see that what kind of effects are people having and what's that in the long term. But it can't happen right now with the SNP Scottish Government not giving the right resources to the NHS, which is a devolved power. So thank you, but Fiona, honestly, and I hope you honestly do get better. And there's lots of things that I go for, lots of walks and different things to help me feel better. But I think there's a lot we have to do in Scotland to make sure that people like yourself and people, even myself, that went through are heard, and we can put actions in place so that other people don't go through it. Thank you.
Thank you, Pam. Thank you. We will take next, last in this round. No, not last, sorry. Maggie from the Green Party, please. And then Graham.
Thanks very much, Carmen. And Fiona, thank you for sharing your story again. I know every time you do it, it takes lumps out of you. So thank you for doing that, and for using it as a way of giving voice to so many people that have been unheard and continue to be unheard and ignored. Your courage is quite inspirational. I think there are There are lots of elements in your questions, and I think I might not address them all in the order that you've asked them, but I hope what I say makes some sense, at least. I think one of the important things to say here is around how our pharmaceutical research practices work, and how our research and development works. You know, in some ways, it's phenomenal that we've had the pharmaceutical approach to vaccinations that we've had in the last 15 months. That's partly been because there hasn't been the drive to you know, to halt the processes, as happens with so many other research processes. But I think you know, we need to focus. We need to have a very, very clear focus on vaccine research, and on virus research and vaccine research, because you know, we know that will reduce the number of people getting the viruses, and so therefore it will reduce the number of people getting and suffering from post-viral conditions. By increasing vaccine capacity, we will be in a better position to deal with future infections like COVID or other viral conditions. I think health and social care integration has been a significant challenge for some time. It's absolutely the right thing to do, and I think we have some we have some of the structures in place, but there's a huge cultural element that has been a long time in coming. We see, you know, we see it absolutely crucial. The evidence through the COVID pandemic. We know that as you know, we knew it existed before with dementia, and we know that long COVID sufferers, the elderly, and people with disabilities are those who need that integration really to be working absolutely properly, and for there not to be some of the bickering that quite frankly we know has been happening between health and social care. If we're talking about genuine integration, that work on the culture of what our health and social care system looks like needs to take place. That's why I'm really pleased that the Greens and others, I know both Paul's mentioned it, and I'm sure Graham will as well, we support the development of a national care service. But the important thing for me is what that looks like. I want the service to have care and human rights at its heart, and it needs to have citizens' voices at its heart too. I think it'll be really important, especially as older people, disabled people, and other often left out and ignored voices. Those are the people who will be served by the NCS. So we need a person-centred approach, learning from what has been done with Scottish Social Security Service, putting citizens in the middle of designing services, putting citizens in the middle of the discussions of what things should look like, how they should be implemented. So we need to make sure that both individual provision of care it has those voices heard, but also running it right through the management of the service. And I think that means including workers in both workplace decision making and in governance. I think, you know, it's important to have those voices heard all the way through, not just at the point of service delivery. We know that when we build software, we user test it. So we should put the same approach at the heart of our care service, using design approaches to make sure that services provide the citizen with what they need. And I think if we align this with our democratic structures, we can create genuinely better holistic care, health and social care for all. So I'd be really, really keen to see citizens panels, patient panels being involved in both, you know, frontline service planning and design, but also in the longer term strategic planning for future delivery. I think we also need to acknowledge that chronic illness has always been a kind of Cinderella in the healthcare and social care system, and we need to change that. All of this needs appropriate investment, and Scottish Greens are committed to investing in these things because we know that people's health and well-being is foundational to a good society. You know, economic arguments only work a healthy and engaged population. Thank you.
Thank you, Maggie, for your response. We are taking now Graham, please, from SNP.
Thank you, Carmen. And may I also associate myself with the comments that Maggie's made in regards to the Fiona's testimony, and I know from knowing Fiona what a brilliant, inspiring leader she is on this and many other questions. And I thank her for her contribution. And I want to just briefly say something about what I think Yvonne might have said, which is about the risk to migrants and to asylum seekers who are unable to control the environment they live in, but are forced in a COVID emergency to live in circumstances which mean that they can't possibly obey the social distancing rules where they eat and where they sleep. And just, the examples we've had all across the country, actually, but also across the UK, show that where refugees and asylum seekers are accommodated by people like Mia's, they can't possibly have their health care needs and any of their needs properly looked after in those circumstances. So there ought to be complete rejection of the use of these kind of hostels to accommodate the most vulnerable people in our society who don't have full and equal rights. So there's an equal rights question around the COVID question that we also need to engage. But it's been important to have that perspective from Fiona in this conversation. It's made a big difference to the campaign so far. So I thank her for that. I'm going to say this, though, that one of the ways in which we can do this properly is an example in the way that we've set up the Social Security Agency in Scotland. We co-designed that system with people with lived experience of benefits in mind. Similarly, in the Social Justice Commission, which is sat on, we looked at and examined the case for a national care service along the lines that Maggie's talking about. And that's one of our key recommendations, which has gone into the SNP manifesto for this election. We will establish a national care system which looks after the workers, looks after the residents too. So we will do that. But I suppose one of the key things that's happened in the previous parliament, Stuart McMillan, the MSP for Greenock, he actually mentioned this in the last parliament. The health committee had actually done a citizens panel in January just there. Several experts that we will know in public health and in immunology and so on gave evidence sessions, just as we've just done in this session today. And that was a good way. 20 members of the public then basically sat down and made decisions about the strategy. We talked about elimination strategies versus the other forms of strategy, and there was a very clear steer towards the elimination strategy, and also some of the measures that were proposed as ideas for going forward to control future pandemic outbreaks were recommended from that citizens hearing. So I'd be in favour of citizens hearings, citizens panels as a good way to engage people with disabilities, disabled people, to actually form a policy that will respect their needs. There's no doubt that long COVID is going to be a phenomenon for a while, and that the questions like universal basic income will need to take account of if we want to implement those policies. We could have done a version of universal basic income during this pandemic. How better to look after people who didn't have to go to work but were felt compelled to because of the economic imperative, who were put in vulnerable situations, who were exposed to COVID situations, who didn't need to be because they weren't fully economically supported. A universal basic income trial would have been a far better expenditure for the UK government to have done, but we didn't have the powers to do that yet because we weren't an independent country. In an independent Scotland, we'd be able to actually put a system in place for pandemic control, which will actually properly deal with some of the issues that we talked about today. That doesn't mean we're not absolving. I'm not absolving our government of any responsibility in this. It's pretty simple. The UK government's messed up here. There's no doubt about that. Us hitching our wagon to the foreign nation strategy didn't help us. So the moment we started to break from it, we had better results. And we have, in fact, got the best performing health service in the UK in terms of dealing with general health. Our waiting lists are much smaller than they are down south, and we've had far fewer deaths and hospitalizations in proportionately. That doesn't mean that's brilliant. There are things we could have done, and I suppose in the care home crisis, we were in a situation where we know people were vulnerable in hospital. We know that people got COVID in hospital, and that was one of the things we saw from Italy and Spain. People got it in care settings, whether they were in the hospital or in care homes. The difference was that there was less medical backup and support in care homes, which led to more deaths. So there was a clear failing at that point. And we learned the lessons pretty quickly, and we saw that improve in the second outbreak. I want us to have a third outbreak. And for that to happen, we need to